We're going to talk about lateral cutting drills today. One of the things that we commonly see in the terminal phase of rehab with our athletes is movement quality issues with the lateral cutting. John's going to go ahead and demonstrate a couple of drills that I like to use for those athletes who don't like to initiate correctly. So when we're looking at our movement for cutting, when we're reteaching cutting, we're reteaching them very slowly to get in that upright posture with their trunk, shoulders, hips, knees, and ankles aligned over each other. For those that have a tendency to start initiating from the shoulders too quickly, one of the drills I like to use is to place something tall right next to them for when they're about to initiate the cut and put a mirror in front of them. So what that's going to do is give them a visual cue to see how far their shoulders are away from that tall object. So John, go ahead and demonstrate that real quickly, and go ahead and slow for it. So what John's doing here is, if he has a mirror in front of him, he's going to be able to see how far away he is with his shoulders. If he's too far away, if he's initiating too early, then this is going to give him a visual cue. Another thing I like to use is, if they're still not seeing it, you can even provide an external cue. One of the ways I like to do that is if John goes ahead and gets in that single leg squat position again, good posture, kind of give them a jersey pull or a tug on their shirt. What that's going to do is, again, give them an external cue to make sure that they're not initiating too far too quickly. The last one I like to use is just a manual cue to the hips. So they might be able to get over their posture now, but they're still initiating at the shoulders. So if you kind of give them a manual cue to that hip and kind of have them push into you very slightly at submaximal pressure, what that's going to do is just allow them to re-educate their body to start initiating from the hip. Always follow that up by reinforcing that with a couple repetitions. So John, go ahead and just perform a few there. So as you can see there, John just kind of initiated from the hips a little bit better after that. These are some of the lateral cutting drills that I like to use.